And we know that the average toddler will get around 12 viral infections per year.
12?
Yeah,
Wow.
between 8 and 12. So actually that's on average 1 a month. And if you condense that into the colder months, so when viruses are most prevalent between autumn and winter, you're probably looking at 2 a month, which if it takes them a week or so to recover from each one, it is no wonder that a lot of parents will say they are literally just getting over one thing, and then the next thing hits, and then the next thing hits. And so it can feel like they almost never fully recover whilst they're building that immunity. But I think the difficult ones are often where...
In this episode, we're joined by paediatrician Dr. Lily Parker to talk all things childhood illness. From common colds to chickenpox, we're covering the basics. What's normal to what to watch for, and which myths need busting. If you've ever wondered when to worry, when to wait, or whether antibiotics are really needed, this one's for you. Lily, it's a pleasure to have you on the podcast here today. Thank you for joining us. Let's start with the basics. What are the most common illnesses and viruses you see in children under 10? Are there typical patterns through the seasons that parents can be aware of?
So, I mean, there are thousands of viruses, and to be honest, it is a huge range of stuff that I see. So I work in the paediatric emergency department. So I see children who have walked in with their parents, but also referrals from GPs. And our busiest time is kind of autumn and winter, which is when viruses are at their peak generally. But we do see children with different viruses and bacterial illnesses all year round. I guess some of the most common ones we see, so in the autumn and winter, we see a lot of bronchiolitis, which is caused by a virus called RSV. But similar symptoms can also be caused by a whole host of simple viruses. The common cold virus, for instance, can cause some nasty symptoms on its own. So rhinovirus, we see that quite a lot. We also see things like hand, foot, and mouth and chickenpox, which are both caused by viruses and cause nasty symptoms and rashes. And then we get the peak of kind of D&V as well, both in the winter and actually sometimes in the summer months. So we see lots of viral gastroenteritis type picture. As well as a whole host, I'd say, of other illnesses. So it is quite varied, but I would say, you know, peak time is often autumn, winter, but we do see viruses all year round.
Okay, so it's a bit of a myth then, is it, that these things tend to occur really in that autumn, winter? Because I know from my own experience, actually, I was quite caught out when we all caught a stomach bug in the summer. I was expecting to really only get that in the winter months. So to be wiped out with that in the summer holidays last year was a bit of a surprise.
Yeah, I would say stomach bugs are the one thing that we do see all year round. And especially at the moment, we are still seeing children in A&E with symptoms of stomach bugs. And there isn't such a seasonality to them, although they do, again, things like norovirus tends to peak in the winter, especially in hospitals. But definitely the cold and flu type illnesses do peak in the autumn and the winter. And often when children go back to school and the weather starts to cool down, that's when they really start to ramp up. So October, November time, it gets really busy for us in the Children's Emergency Department. And then those viruses will linger throughout the kind of winter until the spring. And then we get a little bit of a reprieve between the months of kind of March and September in terms of the common cold and flu viruses. But other viruses do hit around that time. So like chickenpox is actually most common in the spring. Just as you're getting over all the winter illnesses, that's when things like chickenpox will come and bite you.
There's always something with children, isn't there? That's one thing I've learned with having 3 children. Someone always seems to have something.
Yes, they will.
So colds feel like obviously a constant companion, especially when they're really tiny. What's your go-to recommendations, and what are the red flags to look out for that it might be something more?
Yeah, I think, like you say, when they're little, especially at toddler years, it's really common for parents to say they are just continually snotty. And we know that the average toddler will get around 12 viral infections per year.
12?
Yeah,
wow.
Between 8 and 12. So actually that's on average 1 a month. And if you condense that into the colder months, so when viruses are most prevalent between autumn and winter, you're probably looking at 2 a month, which if it takes them a week or so to recover from each one, it is no wonder that a lot of parents will say they are literally just getting over one thing, and then the next thing hits, and then the next thing hits. And so it can feel like they almost never fully recover whilst they're building that immunity. Now, some kids will get viruses and you almost won't know that they have the viruses. So they may not get a fever, they might just have the tiniest bit of runny nose, and other children may get all the full kind of progressive symptoms. They might get high fever, runny nose, sore throat, cough every time they get a virus, and that can be really exhausting for parents when they feel like their children are constantly battling these nasty like winter viruses. In terms of things to look out for, really, it's a really complicated topic to go into in brief, but I suppose fever is one of the things that is normal when you get a virus. So your body mounts a fever to try and kill off the virus that's there. But if your children have a temperature for more than 5 days, or if they look really unwell in other ways with that fever, so if it's not just a little bit of snotty nose and a little bit of a temperature, if it's kind of nasty coughing, increased work in their breathing, if they're struggling to breathe, if they're struggling to take in fluids. So most children won't eat very much when they're a bit poorly. We don't mind so much about food, but if they're not able to drink good volumes of fluid and not kind of weeing regularly, that would be something that would worry us. So it's kind of like prolonged fever for a long time that's not getting better. Other symptoms that are getting worse, so like breathing things and coughs. And then, the fluid intake, which is really important, basically.
Okay, so it's good to know what to look out for there, because mine definitely go off food when they're poorly, but like you say, they will often still be drinking. So I guess it's just as long as they've still got those fluids. Yeah,
and if a child has a really nasty tonsillitis, they will stop drinking as well. And that's kind of the point at which you realise that maybe something that's started as a mild virus has turned into something more serious, actually, if they're not able to drink. And therefore they've, stopped weeing so much, they stop producing so much urine because they're actually getting dehydrated and they're running a fever, which means they actually need more fluids because they're hot all the time. Then that's when you can kind of run into trouble. And although a lot of these things are still viral and don't require antibiotics, they may require other forms of treatment or management in a hospital setting. So there are lots of signs, and there's lots of good resources that you can use to kind of direct you as to when something as simple as a cold gets to a more serious kind of stage.
What should we be doing then when they've got a fever? Because I know there's a lot of conflicting advice in there, isn't there, as to whether we should strip them down, if we should try and cool them down, or what exactly we should do.
Yeah, it depends a little bit on how your child looks when they have a fever. So as I said, a fever is a really normal response for the body. If you get some kind of pathogen, be that a virus, a bacteria, or a fungi, whatever it is that is causing an infection, your body will try and kill that pathogen by making the body hotter, because most pathogens don't enjoy that kind of hot body temperature and they'll struggle to replicate and make more of themselves. And so fever is normal, but there are times when children struggle more with a fever than others. Some children might run hot and you might really not notice huge amounts. Other than them feeling warm, they may be okay in themselves, they may still be playing. Other children may become very, very flat when they have a temperature, like very lethargic, not want to do anything, not want to play. Some children will become less responsive when they have a really high temperature, or they may be in pain because of other symptoms being caused by that virus or that illness. And that's probably the time to step in and actually do something about the fever by treating it with medication. So we call them antipyretics, but most people will call them kind of Calpol or Nurofen, which is paracetamol, ibuprofen. So you don't always have to treat a fever just because they are hot. You don't have to give those medicines.
Okay, I didn't know that.
They are displaying other symptoms. Like they're in pain or they're really lethargic or they're just struggling with that temperature. That's probably when you should jump in and treat it. In terms of stripping them off, we say, yes, you can take layers off for sure. And definitely in the summer when it's quite hot anyway, we've been advising parents to make sure that if they've got a fever, you strip them down either to their nappy or just a single layer. But we don't recommend kind of immersing them in cold water or cooling like cold flannels. Simply just taking an extra layer off, and sometimes like a fan or something can help cool them down naturally. But you don't want to try and make them too cold.
Yeah. Why is that? Because I know sometimes, like if I've had a fever, I can sometimes still want to be wrapped up, even though I feel like I'm burning up.
Yeah. And actually, that's very normal. Like, it's a slightly confusion of the body that you're quite hot, but you'll feel quite cold. And therefore, it's not very pleasant for people to kind of be, imagine being stripped off and dunked in a cold bath. If you were feeling like that, you probably wouldn't be very grateful.
Yeah.
But actually, you don't want to cool them down too fast because that can also cause trouble. So you want to just gradually bring that temperature down. And
Right.
usually by taking a layer off, like pointing a fan at them, maybe offering them a cold drink or something like that, that can help in a kind of slow way without shocking the body by suddenly, if it's winter, say, and it's only 0 outside, don't strip them off and take them out into the garden. That would be quite a lot for their little body to cope with. So
Yeah.
just a gradual decrease in temperature is what we're looking for.
Okay. So tell us a little bit about what's the difference then between Calpol and Nurofen, and when should we actually be using them?
Sure. So Calpol is a brand name. It is probably the most popular brand that we have in the UK. But if you go to other countries, you won't find Calpol. It has different names. So Calpol is paracetamol. Nurofen is a brand name for ibuprofen. Many pharmacies and shops will actually do their own brand of them as well. So you can often find cheaper alternatives that are exactly the same in terms of their underlying medical properties. And paracetamol, we know, is a really good pain reliever. It also brings down a fever. But we, as medical professionals, are not 100% sure how paracetamol works, actually. Even the pharmacists who make it are not 100% sure how it works. It's a really old drug. It's been being used for a really, really long time. We know that it's very safe, but it's the mechanism that it works by is a little bit less clear than ibuprofen or Nurofen, which is an anti-inflammatory. So that one also will treat fever and pain, but it also reduces generalized inflammation in the body. So I think it's really difficult because sometimes you may just want to use both of them. Other times, if it's something very specific that they've got, for instance, if they've got tonsillitis and you know that their tonsils are really, really big and inflamed and they're in pain from that, then you may just give ibuprofen because that's an anti-inflammatory that's going to reduce the swelling in the tonsils, but also help with their pain and their fever. And then if that wasn't enough, then add paracetamol on top, for instance. Whereas if it's a generalized illness and you're not exactly sure what you're treating, but they've got a little bit of temperature, you're probably going to reach for the Calpol because that's a simple way of just relieving their temperature. And you're not looking quite so much for the anti-inflammatory properties. But both of them are really safe and both of them work really well for kids. Paracetamol you can use for as long as you like. So you can use it for, weeks if you need to. Some children with chronic diseases will end up on paracetamol for months on end. Whereas ibuprofen, we tend to say you shouldn't really use it for more than about 5 days in a row consecutively. So it's more for like short illnesses. Just because there is a small risk of some side effects like upset stomach with long-term use. But it's absolutely safe to give it, for a few days during an acute illness.
And what about if your child is really poorly and really struggling with something? Is it okay to alternate them so that they can have them slightly closer together if they're really struggling?
Yeah. So if they're really struggling with something and you're struggling to kind of keep on top of their fever and their pain, you can definitely use both. And we usually say, try not to give them at exactly the same time. So stagger the doses so that you always have a medication that you can give. And you can give 4 doses of Calpol per day, 4 to 6 hourly. And you can give 3 doses of ibuprofen per day, 6 to 8 hourly. So if you kind of work out in a 24-hour day, if you will have something you can give every kind of 2 to 3 hours if you stagger them. So that can be quite helpful, especially if they wake up in the middle of the night and they maybe already had their 4 doses of Calpol and you're thinking, actually, they still need something. They're uncomfortable. They've got a high fever. You can kind of give them a dose of ibuprofen or Nurofen at that point.
Okay. And what age is that from? Is that from the recommended age on the bottle or is there a specific age?
Yeah, so the bottle will tell you what age you can give these medications safely from. Calpol, we usually say that you shouldn't give them to babies under 12 weeks. And that's more because we don't want to mask fever in babies less than 12 weeks old. So we want to know if a baby less than 12 weeks old has a fever, because if they have a fever, they need to be seen by a health professional because their immune systems just aren't developed enough yet. And it can be a real red flag for serious infection. But they will often say that after the first set of vaccinations at 8 weeks, you're allowed to give a couple of doses because we would expect them to have a little bit of a temperature So for like 24 hours after the first set of vaccinations, it's fine. So it's not that the paracetamol itself is unsafe, because we will use it in hospital for really small babies. It's more that we don't want you to be giving it at home and actually not notice that they are becoming more poorly or having a fever that needs to be seen in hospital.
Okay, that's
So
interesting.
that's the reason for that one.
So do you have any top tips for managing sickness and diarrhea then? Because as you said, it's something that we suffer with all year round, and we know how it can wipe out the whole household and it can be brutal.
Yeah, unfortunately with DMV, there is no magic one that is going to get rid of it once it starts. And often parents will panic when they start vomiting. And we do see a lot of parents who end up bringing their little ones in quite early on in the illness because, as you probably know, with 3 children, these bugs can be really virulent. So when they start vomiting, they can vomit quite a lot in a really short period of time. And then as the bug works its way through the digestive tract, you often get kind of changing symptoms. So it will start with the vomiting, then they get tummy ache. And often if they're little, obviously they're not very good at describing that tummy ache, but they'll often just be quite distressed because they're getting crampy tummy pain. And then they'll get the diarrhea as it hits the intestines. And the diarrhea can actually linger for quite a long time, even after the vomiting has settled. And that's because of the inflammation that bug causes in the bowel. So the bowel basically just starts to lose water, and that water only has one way to come out. In terms of treatment, so the most important thing with DMV is fluids. Keeping fluids up is the only real way you can make your child feel better. And actually, they're losing quite a lot of fluids in quite a short period of time. So you will find that if you're not able to get fluids in, they will become quite drowsy and lethargic relatively quickly. So within 24, 48 hours.
Should we be trying to put things like electrolytes in the water? I've heard of that being used.
Yeah, so you can for sure, and you will be losing electrolytes through the vomiting and the diarrhea. But actually what we say as paediatricians is it doesn't really matter what's going in as long as something is going in.
Okay.
I would, if they have vomiting and diarrhea, I often say completely kind of forget about food. Unless they're asking you for food, don't worry about it. It's the fluids that's the important bit. And often clear fluids will be better tolerated than milk. So water or squash or dilute apple juice just is slightly easier to digest than milk. So we usually say start with fluids that you can see through, which is what we call clear fluids, unless a baby is less than 6 months old and only being breastfed or formula fed, in which case you do need to stick to what they would normally have, which will be breast milk or formula milk. But once they are kind of weaning and on other types of fluid, then just focus on the fluids. In hospital, we use apple juice. It's really good. It's very well tolerated. You can dilute it down with water so that it's not too strong, and it's got sugar in it, which if you're not taking in any food, obviously, and you're using up energy to try and fight a bug, it's quite important that you give your body some nutrition.
Makes sense.
Actually, just sugar is all your body really needs to kind of get better. So something like apple juice diluted or full sugar squash is actually better than plain water and will help them get better quicker.
What about if they do ask for food though? Because I've had with mine, they'll be sick and a couple of hours later they'll say they're hungry, and I feel a bit confused because I'm like, the old thing that my mum used to say to me is starve a bug. But then I'm like, well, they're small and they want to eat, so then I'll let them eat, but then they're sick. And then I'm like, I don't know if I should listen to them or not.
It's really hard, isn't it? If you've got a toddler, he's going to have a tantrum over not eating. I think if they're asking for food, you can give them food, but I would be aware that probably I would be aiming for a period of 6 to 8 hours where they haven't vomited before you jump in and give them food, if you can avoid it. And if they're desperate to eat something, stick to something really, really plain. So something like crackers, breadsticks, or like pureed fruit, and probably avoid dairy, avoid, a big meal straight away. Start with something little and see if they tolerate that. And if they manage, a piece of dry toast and a little bit of fruit and they're not sick, then of course you can offer them more stuff. But if they're then vomiting again, I would probably go back and stick to the clear fluids to begin with.
Okay.
and then move on. And you can move on from the clear fluids to things like smoothies, or again, introduce the milk back in, other types of kind of liquid food rather than a solid meal. But definitely my one biggest trick is often saying to parents, switch the water for apple juice. If you want to give the Diarrhea sachets, that's fine. Some children just don't like the taste of them, and therefore it's not the be all and end all. But if they like them with a bit of Ribena or something thrown in, then great, that's good too. And make sure that you're only giving them little and often. So instead of like a whole beaker of juice straight away, just offer them 10, 20 mils every kind of 10 minutes, rather than letting them drink for thirst, because they will probably drink quite a lot quite quickly, and then it will make them sick.
Okay. And what about, like, is it quite common to get the sickness bug back? Because again, we actually had that happen to us earlier this year. Everyone went down with it and it kind of circulated round again. And one of my children ended up getting it about 3 times in the space of 3 months. He just never quite recovered. He was struggling with diarrhea quite a lot. Got it back, the sickness came again, seemed to get better, complained of a tummy ache, got the diarrhea, got the sickness, and it was just like an ongoing cycle.
Yeah, that sounds like a bit of a nightmare. The problem with stomach bugs is they live for quite a long time on surfaces and things on their own. So, and obviously they're microscopic and we can't see them. So not only are they really, really contagious and will spread through your house like wildfire, but also if you're not absolutely rigorous after a stomach bug, it's quite easy to reinfect yourself. So some of the tips I give to parents are things like, when everyone's starting to feel better, get all the plastic toys you have that are dishwasher safe, put them in the dishwasher and put it on a hot wash to kill the germs on those. Anything you can't put in the dishwasher, then just wipe it down with an antibacterial wipe, but go through all the toys. Swap your toothbrushes. So buy new toothbrushes and throw your old toothbrushes away.
Yeah.
Because the bugs live on your toothbrush and you will reinfect yourself.
Yeah.
Obviously things like cleaning the bathroom really thoroughly with antibacterial, but then also washing bed sheets and your towels on a really hot wash. So more than kind of higher than 60. To make sure that you've killed the bugs on those as well, because otherwise if you wash things on a cool wash, the bugs can still live and survive the washing machine.
Excellent. Okay, that's some excellent advice there. So there's a lot of myths around home remedies, things like putting onions in your socks or Vaseline on your feet for a cough. Is there any science behind these things, or are they just best left behind?
Best left behind, I think.
Yeah.
Yeah. There's very little science behind a lot of the kind of old school home remedies. Having said that, obviously some people swear that they help, and there are things that, you know, don't have a lot of scientific evidence behind them, but people will really, really believe in them.
Yeah, I've had had a lot of people have said to me over the years is the Vaseline on their feet. I can't get my head around how that's going to help a cold, but a lot of people do swear by that.
Yeah, it's not the Vaseline around the nose for hay fever is proven, because actually the pollen will stick to the Vaseline and not go up your nose. So that is a nifty trick if your child suffers with hay fever, putting it around your nose. But on the soles of the feet, no, not going to have any impact on a cold, I'm afraid.
It's good to know. When your child is congested or struggling to breathe at night, what does actually help then? Are there things like steam, saline spray, humidifiers? Are they worth using?
Yeah, so actually there was a really big study done recently which showed that saline spray, which is basically salty water spray that you put up the nose, can significantly reduce the amount of time that children suffer with symptoms from a cold. So I always thought, as a medical professional, you know, how much evidence is there in a salty water? What good can salty water really do? But actually the evidence is becoming stronger and stronger that salty water can make a big impact. And the good thing about that is that you can use saline spray from the newborn age. So because it's not really a medication as such, it is really safe to use. Whereas a lot of the decongestant medications that adults might use during a cold are not licensed or not safe to use in small children. So, for us, we might take some Lemsip tablets that have a decongestant and a paracetamol in them. Whereas for children, generally, it's mostly just the paracetamol that they can take and not the decongestant bit. And because their airways are really small and their noses are really small, it doesn't take very much snot and swelling to actually make them really congested and bunged up. But something like a saline spray, using it kind of 4 or 5 times a day has been shown to make a big difference. I think also having a humidifier in the bedroom at night has got its place. I appreciate that, not everyone can afford one or wants a humidifier in the room, but some of them are relatively inexpensive. All it does is basically releases a bit of water vapor, so it moistens the air in the room. And we use humidified oxygen, for instance, in hospital to help babies breathe if they are struggling with respiratory stuff. So I think making the air a bit moister is less drying and sometimes can help, especially if they're struggling with like nighttime coughing, or they're really blocked up and just struggling to sleep at night because they've got a nasty cold.
What about using the saline spray if they hate it? I've tried it with mine and they viciously fight me to get away from it. And I struggle to know if it outweighs the benefits of traumatizing them with chasing them around the house with it, or if I should just do it anyway.
At the end of the day, the saline spray is not going to be the thing that makes them better. It's not curative.
Yeah.
It may make them better a little bit quicker. So instead of their cold lasting for 5 days, it might last for 3 days. Equally, if they are absolutely miserable because you're chasing them around the house, having to pin them down to stick this thing up their nose, then, they may rather have a cold for 5 days than 3 days of that. But if you've got like a small baby who obviously is a bit easier to kind of manage and actually do that without them causing too much of a fuss, then I think there is a place for it. And actually for adults as well, like if you get a cold, like I'm pregnant at the moment, I can't use decongestants, but I had a bit of a cold last week and I did use the saline spray myself because I desperately wanted to make it better sooner.
Yeah, I don't blame you. Yeah, it's a tricky one, that actually, isn't it? One of my children in particular, he had loads of ear infections from about 2 to probably about 6. They've only just started to get better. So he had a lot of antibiotics and it was really difficult because he hates taking the medicine no matter what. And we tried every trick in the book. I searched online for everything you could think of ways of mixing it in things, hiding it in juice, convincing him, rewarding him. And he just didn't want to know. And I think he was so fed up of taking it. It was really, really difficult. Have you got any kind of advice for anyone that does have antibiotics or something that is trying to get it into a reluctant child?
It's really hard. And I totally understand that it can be really tricky. There is no magic solution to that problem. Some children will be better at taking medicines than others. And unfortunately, if you end up having a child who does end up having recurrent bouts of antibiotics and things, they might be all right the first few times and then they start to refuse to take things. There is no hard and fast rule as to what you can put things in. So I think the majority of medicines, like if you can hide it in something that they will take, then that's fine. But what you have to make sure is that they will actually take the whole lot, and then they're not going to kind of only have the tiniest bit of it, because then they won't be getting the full dose.
What if that happens? Because we actually had that happen. So sometimes you would get a syringe of it in him and he would literally be sick. And then I would feel like out of the dose over 8 days, that might happen 2 or 3 times. And then I would never be sure if the antibiotics were going to work as effectively or not.
Yeah, I mean, if they vomit immediately, we usually say that you can probably repeat the dose if it's immediate. Like if they've literally spat it out or vomited then and there, you can try and give it again. But if it's like even 5-10 minutes down the road, it's really unclear how much the body will have absorbed. So it's probably wise just to wait and give him the next dose. You can add those doses on. So if you know, for instance, that they definitely haven't got 2 doses, you could add them on at the end if you have enough liquid left to add another 2 doses, because sometimes you'll get a whole bottle and that's often a bit more than you actually need. Equally, it's really tricky in kids, and we know that not all of it always goes in. And as long as the majority of it is going in, I'm sure the medicine is still doing its work and still doing its thing. So it's probably, like you say, if you miss two 3 doses in a week's worth of antibiotics, that's not going to be the end of the world. But if they're spitting out every single dose and you're pretty sure none of it is going in, then it may be worth going back to your health professional and actually saying, is there anything else we can do? Can we switch it to a different antibiotic? Because some of them definitely do taste better than others.
Right.
And some of the first line ones don't taste as good as the second line ones.
Right.
So sometimes there is a switch that you can make that might make it taste better. But equally, your health professional needs to know that actually if they've prescribed a week's worth of antibiotics, that your child hasn't been able to take them.
Okay, that's good to know. Do they ever do them so that they come in a slightly stronger dose, so you could perhaps give 1 dose a day rather than 3 times a day?
So sometimes there are some antibiotics that come in different strengths, but most of the time it wouldn't be a switch for the strength that would make very much difference. There are some antibiotics that are only, for instance, once a day, but they won't work for all infections. So it very much depends on what you're treating and what your options are. But some of the antibiotics I know are like 4 times a day, and some of them are once or twice. So again, if your child is really, really tricky with medicines, it's always worth mentioning to the doctor, who might be able to have a little bit of a think. Actually, I'm going to give them the best tasting one and the one that's the least frequent to begin with, because some kids are pretty good at taking them. But as I said, often if they've had lots of them, they start to...
Yeah, I think that was the thing for him. He never liked it, but the fact that he literally went through about 18 months when he was getting an ear infection pretty much once a month, I think he was at his threshold of having to take it sort of 3 times a day for that long. And obviously by the time he was about 6 as well, it'd gone up a bit. So it was like a 7.5 or even 2, I can't even think, 10 mils of it. So it was like 2 syringes at one point, 3 times a day. And he was not having it. So it was a tough time for us all.
Yeah, I can imagine.
So ear infections and sore throats do seem to go around a lot amongst small children. What should we know about treating them then? And when are they self-limiting, and when do we need to know if they're more attention?
Yeah. I think generically as health professionals, and this is on us, we probably overprescribe antibiotics for ear infections and throat infections like tonsillitis. We know that statistically, the majority of these infections are viral, like over 90% of tonsillitis and ear infections are caused by viruses. There is a small proportion that are caused by bacteria that do need antibiotic treatment. And we do have some kind of tools that we can use to assess children, where maybe it calculates a score or gives us the likelihood that this is going to be a bacterial infection rather than a viral infection. But I think the difficult ones are often where maybe the symptoms are persisting for a long period of time. The parents have come back more than once with ongoing symptoms. And often doctors will feel like, there's only so many times you can say, we're not going to do anything. We're going to watch and wait. We're going to wait for them to get better on their own before you feel like you need to give them a medication to make it better. But we do know that a lot of the time, even though we may end up giving antibiotics, it probably isn't the antibiotics that actually fix the problem. And it's probably more that they've reached a point in their illness when they were going to get better on their own anyway. If you're on day 7 and they've already been unwell for that long, and then you go to the GP and eventually you get antibiotics, it may be that they were going to get better anyway. So it's really tricky for us to know which ones are bacterial and which ones are not. Sometimes we will do things like swab tonsils, so like put a little cotton wool bud on there and then send that off to the lab. But again, not always, and not all doctors have that kind of test at their fingertips ready to use. Things like ear infections, we can treat the symptoms without treating with antibiotics. So there are other drops we can give, like pain relieving drops, that we may try first. So we treat their pain, but we give them the time to see if they're going to manage to fight off the virus, for instance, on their own before giving them antibiotics. But for ear infections, for instance, if the eardrum is perforated, so if it's actually ruptured, if they've got fluid coming out of the ear, if it's both ears and they're both looking really nasty, or if they become really unwell in themselves with it, then often we will cover with antibiotics. Whereas if it's just isolated kind of pain on one side with maybe a little bit of a temperature, sometimes we'll watch and wait. So there is different times. And similarly with like tonsillitis, often if it's just swelling of the tonsils and pain, then we can treat with medication for pain and wait and see. But if they get really, really so big that you're struggling to eat and drink, or they're covered in pus, then sometimes we will end up giving antibiotics.
It's a tough one as a parent, isn't it? I think you're so right. We often, I guess, know that maybe antibiotics are being overused and prescribed now. But you kind of, as a parent, I guess you want to do something to help, don't you? And when you do reach that sort of day 6, 7, and your child's still really poorly, it's hard to know yourself whether they need those antibiotics or not. And you worry if you're missing the moment that they need something more, or if you're doing the right thing in just keeping them dosed up with Calpol or Nurofen and keeping them hydrated.
Yeah, and as a parent, it's actually not your job to make that decision. You know, I do think that if you're at that point in the illness where they've been unwell for quite some time, and you've tried all the basic things like giving pain relief, like, you know, fluids, and they're still poorly, it is up to a health professional to make that decision for you as to whether or not they need antibiotics. We don't expect parents to be doctors. And as I said, I think it's hard even for doctors sometimes. We read the literature, we know the NICE guidance, we know that it says that 90 to 95% of these infections are caused by viruses. But equally, we want to do something to make your child better too. And so it's always a balancing act. And some parents will be really anti-antibiotics. They won't want to give any, and then maybe more willing to hold on for a longer period of time to see if their child gets better. And other parents who maybe have found that their children get better quickly when they're given antibiotics, if they have that experience once or twice, they'll start to think that antibiotics are the answer, and actually then they really want them. And then you have a bit more of a challenge on your hand as a health professional to say, actually, you know, most of these are viruses and most of these won't get better just because of the antibiotics.
Yeah, no, I can understand that. Are there any over-the-counter medicines or treatments that you think are underrated or overused by parents?
I think cough medicine for children is overused, not underrated. So the evidence is that basically there is no strong evidence for cough medicine in kids making a difference to coughs. The majority of them are some form of sugar syrup with maybe a medication thrown in. But the majority of them just kind of coat the throat and may make it a bit less tickly. They did a study looking at the difference between cough syrup and 2 teaspoons of honey, and they found no difference at all. So you could give 2 teaspoons of honey to your child before bed, and that would have the same effect as cough syrup. So some parents will come in and they'll say, you know, I've bought this cough syrup and I've been using it for a week. It's made no difference. And I say, unfortunately, it won't really make any difference because there isn't very much evidence behind it. Caveat to the honey thing, don't give honey to children under 1, but over 1s, you can have honey. Underrated. I mean, I think the saline spray is probably underrated, actually. I think a lot of people, as I said, just think, oh, it's salty water, it's not going to do anything. But it can really make a difference. So those things. And also antihistamines for rashes. So for itchy rashes especially, we often think of antihistamines as just being for hay fever or allergies. But I often recommend them for parents if your child has a really itchy rash that's bothering them at night. Even if that's a viral rash, sometimes a single dose of antihistamine can just help them settle.
Okay, it's good to know. So finally then, what's your best advice for helping children build their immunity and stay well, especially when they're in environments like nursery or school where bugs are just constantly circulating?
Parents ask me this all the time on my Instagram channel. Like, what can I do to stop them from catching all these bugs? There must be something, you know, what vitamins can I give them that's going to magically boost their immune system? You know, you can't really boost your child's immune system, unfortunately, through any other way other than keeping them really healthy in all the basic stuff. So plenty of sleep, you know, making sure your children are getting enough sleep, because if you're tired, your immune system does struggle. Getting your kids outside as much as possible. There are less bugs outside, so fresh air really is good for them. And these bugs tend to kind of replicate in nice warm environments, like you say, in nurseries, inside. That's where the viruses will really be kind of replicating and spreading. So if you can get your kids outside in the fresh air as much as possible. trying to get your kids to eat healthy. Now, I know that's like really tricky, and some kids just aren't interested in eating anything green or orange ever, but fruit and veg and stuff like that is just really good for us. So it's all that kind of basic lifestyle stuff that often sounds really dull when doctors bang on about it, but equally actually is the stuff that is evidence to show that we can make our children healthier by good diet, good sleep, getting outside more. Yes, a lot of children will end up taking like a multivitamin that may have some benefit, but actually if they have a really good diet, that is the most important thing. And most children, so the government recommends a dose of vitamins A, C, and D once a day. But actually, if they're eating really well, often they don't even need that, to be honest. It's often just the fussier children and the children who maybe are a little bit beige in their preferences that will definitely need that kind of added goodness. And there is nothing you can do to kind of stop the viruses getting in. If they get in, they get in. And you've probably you've got to know a little bit about what to do when they do and when to worry. And that's kind of why I set up my page in the first place, was because I know that a lot of parents feel unsure about when to worry and when not to, when to panic and when not to panic,
Yeah, it's a big responsibility, isn't it? I find I worry less about myself when I get unwell than I ever have done my children, because they're my responsibility, and you just want to keep them safe, don't you?
Absolutely. And we don't, as I say, I don't expect everyone to be a health professional, and your children are the most precious thing in your world. And therefore you have naturally more anxiety about them than you do about yourself or the other adults in your life. And so parents will often say to me, I'm really anxious about, when they get sick. And I say, actually, most of the time that's normal that you're feeling anxious when they get sick, because you don't want them to be ill. You want them to be well. But equally, a little bit of knowledge goes quite a long way in this area. And just by knowing a few of the basics of kind of when you should worry, and knowing the basics of actually what's normal with coughs and colds and viruses, and what you can do for them at home, and when to go and ask for help, that's really helpful for parents to have that. A lot of people don't have any information or any knowledge when they become parents. And you pick it up as you go along.
Yeah, definitely. I'd say by number 3 now, I had no idea when I had one just how many different viruses, rashes, viral infections, bacterial infections that just even existed. I'd never heard of half of them until I had kids.
No, and you were probably more anxious with your first one than you were with your third one, because naturally, once you've seen these things before and you've realized that actually the majority of coughs and colds in kids are just that. They are just coughs and colds. And within a few weeks, they will be on the mend and they'll be better without you doing very much as a parent. Equally, there will be the 1 or 2 times where they do become more sick and they do need intervention from a health professional. But once you've had 1 or 2 children, you start to totally understand and trust your gut a little bit more as to, actually, they're sick, but they look fine. Or no, this is not them at all. I'm actually really worried. This has been going on too long, or that, they're really struggling with their breathing. I'm going to get it checked out. And often it's that the first time parents are understandably just don't have that information yet. They haven't haven't learned it.
Absolutely. Lily, there is so much useful advice in this podcast. So thank you for joining me here today. I feel like I've learned loads myself that's going to be really beneficial, especially the tip there about the apple juice with tummy bugs. Definitely one I'm going to try next time we all get wiped out. Yeah. So thank you for joining me and for sharing all of that.
No problem.